services that either.
In a statement, Victoria University says RNZ's coverage about Danny Sundry has been inaccurate, misleading and irresponsible. For Morning Report, Charlie Drever.
Well, listening to that at 23 minutes past 7 is Marlon Drake. He's Victoria University Students Association President. Kia ora.
Kia ora.
Is Victoria University trying to sweep this under the rug?
Look, whether or not they're trying to do that, I think it's a bit past that point now. It's obvious that a lot of our students are pretty upset about what's happening and what they're looking for. There's some really clear messaging and some reassurance that there are services and there is support for them should they need it. And that's something which isn't new actually within our community. It's something which we've been hearing all year at the Student Association, not just this year but in previous years. And it's quite awful, the topic, especially like mental health, where there is so much stigma to talk about in the first place. It's hard.
Well, let's talk about those services. Are they there?
There are absolutely services available to students on campus. The problem is, though, is that they're currently really under-resourced and under loads of pressure, which is resulting in some pretty gnarly wait times facing our students.
And so that's the problem, not that the services don't exist, but that you could go in to see somebody and be told, well, we can see you in 18 months or we can see you in a large period of time. Whereas if someone needs help now, what does the university need to do to be able to deal with that sort of situation where there are people who are not able to get the help that they are looking for?
It's a really difficult situation because with the student counselling services and the way that they're resourced, currently they are only resourced by the student levy. There is absolutely no public funding going into a really valued student health service, which services a large proportion of the community. And this is the same around the country actually. At other tertiary institutions as well, we have student counselling services that are not being funded by receiving any public money. That's a massive problem when they especially when they're servicing such a huge portion of the 18 to 25 demographic, which we keep hearing is so at risk.
Indeed. So should the university step up into this breach when they know they've got students, large proportions potentially of students who've got mental health issues and need to see counsellors rather than get antidepressants from a doctor? What should they do? Should they put more money in?
We've been advocating to the university all year, saying that there needs to be some sort of action, and that the absence of government funding these services, someone needs to step up and something has to be done. There's also a lot of work in other areas where we've been quite successful in working with the university, such as looking at the way that RAs are trained, and we've had some real good success there in advancing that. So there is work being done within different parts of the community. The most important thing now, though, is that we actually need to have an open conversation about mental health. And I think, referring to your earlier comments about sweeping it under the rug, we need our biggest institutions and we need our community leaders to actually be talking about this as an issue, especially for students. There is a view that students are this privileged class and that they should just toughen up, but that's an absolutely rubbish view. And in the reality, there are some real pressures and challenges which our students are facing.
What do you want to see by way of leadership from those in charge at Victoria University then?
I'd like to see some serious consideration around how they're going to solve the issue in lieu of some proper funding from government, and whether that comes from them or whether that comes from some public advocacy and saying actually the Ministry of Health needs to step up and think about why we have a really high quality service that is not receiving any extra resourcing or any extra funding. So if it's not going to come from the university, then we need some support in making sure it's coming from government.
If the university essentially isn't in a position to put any money in or isn't in a position to do anything particularly tangible around this, what is going to be the result?
Well, the fact is there is lots that can be done, and not just in terms of student counselling. This year we've been having some really positive discussion around reviewing academic policy and looking at things like assessment times and assessment hand-ins and assessment deadlines, and saying actually, why is it fair that students are receiving all their assessments at one time? That's an unnecessary bout of pressure. And then also looking at other sort of looking at the causes of poor mental health. So looking at things like a high cost of living, having to work a part-time job as well as performing full-time study, social pressures, cultural pressures, and looking at these things and seeing how we can mitigate those.
Appreciate your time. Thank you very much. That's Marlon Drake, Victoria University Students Association President. We do have an invitation already issued to the Vice-Chancellor of Victoria University, Grant Guilford, to talk to us on this subject. That remains open. If he would like to get in touch with us at any time during the programme, he is most welcome to. It's now 27 minutes past 7.
And staying with education matters...